Okay, I would actually like you guys to repeat after me. Feel free to use your lap or your desk. Ready? Okay, so what you might seem to be a simple rhythmic exercise is actually a coping mechanism for many individuals in hospitals. This is a tactic used in music therapy. So there are many ways that music therapy helps patients, like cognitive ways, ways that help them learning, but I will be giving you 3 main points as to why it is very helpful. So first I will explain what music therapy is. It is a clinical, evidence-based use of music interventions to accomplish individualized goals with a therapeutic relationship. So that looks like a music therapist with a patient sitting down and developing a relationship between each other. And then once the music therapist knows what the patient might need, they will give exercises such as like the rhythmic ones, or maybe they might assign the patient to be in a group therapy with others. So music therapy actually improves the patient's well-being, such as reducing their pain and their anxiety by 50%, which is very amazing because that's half of what they were feeling prior of using music. So music therapy helps the patient communicate their needs. A lot of times individuals with autism or Down syndrome might not know how to express what they might need or what they might want, and that can be very frustrating to the individual. So by being in a group setting, they can learn how to communicate those things and learn how to speak with their peers and learn how to socially interact with others. And what I think is really cool is sometimes this is very popular with teens. They will actually sit down with the music therapist and write songs together about how they might be feeling, which can improve their vocabulary skills. So this next clip is actually an example of a group setting where they're learning how to interact with each other and mimic what the music therapist is doing and what their peers around them are doing. Notice how it's not all the same. They're doing it their own way, and it's a very free environment. And they're just sharing that exchange with one another. Yeah, they make it their own thing. They have fun with it, and it's very relaxed. Music therapy improves motor skills. So with the drumming example, like I gave you guys, it can actually just help them get movement going. Like some individuals with cerebral palsy, might have, they might struggle with those motor skills. So the music therapist would give them an assignment to continue drumming, or maybe sing along with them. There's an example of when I first learned about music therapy. Was the music therapist met with this elderly lady who over the years actually became mute. So what she did was she took a song from the lady's youth and sang it to her every week, and eventually by tapping her hand and singing along with her, the lady who was once mute actually became she was able to sing. She was able to sing, and then that turned into vocalizing, speaking. So that is an example of muscle memory as well. And of course, as you probably know and have experienced, it helps with your emotional health. It reduces stress and anxiety. It it helps the patient understand what they might be feeling, because sometimes you're unsure, and so the music therapist might introduce different genres of music, and the patient can identify which genre they identify most with how they're feeling, which could be like a slow, relaxed song or maybe a more upbeat song. And most importantly, my favorite part is that it just brings joy. Music brings joy to everyone. Everyone knows this. There's something so satisfying about music when all the different notes become one chord, and you just know it's so satisfying to your ear. And that is everything I have to say about music therapy. These are my sites.